Yeah, actually, in the case of BeyondX, Roche approached us with a specific unmet need that they saw and wanted to be provided for. And in this case, it's for young female cancer patients who would like to plan for a family in the long term, but are also facing the immediate challenges of the diagnosis. And I mean, this is what we do at ROX. We work on early innovation, understanding unmet needs, exploring them, but also piloting them with the goal to have a very tangible effect on everyday care for patients. And the challenge in this particular field is that while obviously cancer is more prevalent with age, there are young people who do get the diagnosis. And while it's always a shock to face cancer, there are specific challenges specifically for young people. And in this case, it means that specific cancer types like ovarian cancer or specific therapies do have a negative impact on your fertility long term. And you can take preventive measures, but in current settings, only 10% of women or also men do. And that means currently 90% of patients are not sufficiently educated. That means they will not have the opportunity to create a family after overcoming the illness. And this is something where it's like, okay, we want to change that and actually support the patients. I mean, we always try to move very quickly from like a concept to something tangible to implementation. And in this case, it actually only took us 6 weeks to launch our offer, which supports patient on an educational level, but also provides them actually individual counseling in order to get to the help they need. And in this, we also collaborated with a partner on this to provide very specific individual counseling. And the offer that we launched is obviously not static. It's something that we're currently continuously working on getting more feedback, refining the offers to meet what patients need, but also working very diligently on reaching patients. Like, how do we reach the patient in this like very short and very critical time in order to get them the support and also the measures that they need. But we do see that everything we do currently aligns really well with Roche's commitment in women's health as well as oncology. So a huge part of this project is our collaboration with a global women's health initiative, Project X, that also in the long term has a commitment to close care gaps for women along a whole range of entities and topics. And on the other hand, there is a lot of work in oncology and also the striving towards providing patients with a more individual and also more holistic support. And with BeyondX, we are able to address these like very specific critical care gaps and helping patients. And we do see we have an impact. The patients we're currently working with, they did tell us that obviously facing the diagnosis, they do want to tackle it. Nevertheless, having taken care of your fertility measures means not only giving you the opportunity in the long term to plan for a family, but in this very specific moment of the therapy, they said it gave them a perspective and also hope for the time beyond the illness. And this is why we're doing this.